So I think we should start now. Good afternoon, ladies and gentlemen. Welcome to this webinar offered to you by the Southeast Asia Research Center and Hub of De La Salle University. COVID-19 is affecting every country in Southeast Asia, and it is imperative for researchers to use their skills to understand the various ways it affects our societies. In doing so, we hope that we can better cope with the present challenges and prepare. I'm sorry. I'm sorry for that minor glitch. So as I was saying, in doing so, we hope that we can better cope with the present challenges and prepare for upcoming scenarios. Despite the circumstances, now is the time when up-to-date research on the impact of the virus is most needed in the entire region. The driving force of this webinar series is the desire to serve during these trying times. We want to make data available to government, policymakers, NGOs, and people who are capable of addressing the crisis. Now, this afternoon's webinar is on the heterogeneous age mixing pattern of estimating the COVID-19 cases of different local government units in the National Capital Region by Dr. Ricardo L. Dizon of the Polytechnic University of the Philippines. Before I introduce him, first, I'd like to state that the opinions expressed in this webinar are those of the speakers. They do not purport to reflect the opinions or views of SEARCH or its members. Our objective is to provide a space for academic discussion of various issues. Now, for the participants, since this is the webinar format, you may post your questions on the chat box. Now, please address your comments or questions to the speakers at any time in the public chat space. And for technical and quality purposes, only speakers will be able to use their microphones. Please introduce yourselves on the public chat space by telling us your full name and country, okay, or organization. Please state for whom you are directing your query. Keep the question brief and straight to the point. And please note that this webinar will be recorded. It is being recorded, and you will be able to watch it again later through the Facebook page of the De La Salle University Southeast Asia Research Center and Hub, or SEARCH. Now, I'd like to introduce our speaker. Dr. Ricardo L. Dizon received his Doctor of Philosophy in Economics from the Ateneo de Manila University and Master of Arts in Economics from the Polytechnic University of the Philippines. He is the current chief of the planning section of the Institutional Planning Office and the chairperson of the Master of Arts in Economics program of the Polytechnic University of the Philippines. Prior to joining the academic institution, he worked as an economist and acting corporate planning chief of the Philippine Ports Authority. He is a recipient of the United Nations Conference on Trade and Development Scholarship on Gender and Trade course. His publication and research areas include labor, statistical forecasting and modeling, health economics, operation research, feasibility studies, gender and development, tax incidence, computational economics, poverty and welfare economics. He also serves as a research reviewer in the Society for Advancement of Chicanos, Hispanics, and Native Americans in Science, SACNAS, and in different international journal publications such as Journal of Applied Business Research, Journal of Business Economics and Environmental Studies, Journal of Global Health and Epidemiology. So again, without much further ado, ladies and gentlemen, our speaker this afternoon, Dr. Ricardo L. Dizon. Okay, go ahead, Dr. Dizon.
Okay, good afternoon to all. I would like to present my research paper entitled The Heterogeneous Age Mixing Pattern of Estimating the COVID-19 Cases of Different Local Government Units in the National Capital Region. The content of the paper as follows. We have the introduction, materials and methods, results and discussions, and recommendations. The world is currently experiencing a global pandemic crisis brought about by the coronavirus, or commonly known as COVID-19. The COVID-19 is a cluster of pneumonia cases caused by the newly identified B coronavirus, which was initially infected a huge number of people living in Wuhan, China in December 2019. This forced the government to implement enhanced community quarantine across the country. The lockdown system aims to reduce the reproduction of COVID-19 through maintaining social distancing. It emphasizes the two major objectives of lockdown system, which are first is mitigation, which preventing the peak of maximum capacity of each healthcare provider, such as hospital and infectious disease center. And the other one, we have the suppression, lowering the confirmed cases to low levels through observing social distances of the entire population, suspension of works and classes in schools and universities, and prohibiting mass gatherings. This study aims to forecast the transmission rate of COVID-19 in National Capital Region and to investigate the effect of enhanced community quarantine being implemented by the government to prevent the exponential growth of the coronavirus in the Philippines. For the materials and methodology, the mathematical modeling plays an important role in epidemiology, which serves as a tool in analyzing the spread and control of infectious disease. It was first used by Volterra, which shows that the indefinite coexistence of two or more species limited by the resources is not possible. According to Epidemic Model, the infectious disease can be transmitted into different ways. One is horizontal transmission, which occurs by direct contact between infected and susceptible individuals. And the other one is through vertical transmission, which occurs by direct contact between infected material and susceptible individuals. The population facing a possible transmission of pandemic disease can be effectively captured within susceptible infected framework under the assumption of multiple possibility of modes of transmission, which are horizontal, which is direct contact, and vertical, which is indirect contact. The Alley effect, which alters the net reproduction term due to the mating limitation or predator saturation. The Alley effect is named after the scientist Alley, which slows down the rate of population spread and clustering of population. In order to forecast the COVID-19 cases in the National Capital Region of the Philippines, I used the multi-group susceptible infected recovered model, which is stage progression, or also known as mathematical model of mixing pattern between age group or heterogeneous mixing pattern of transmission. It incorporates the pattern of mixing among the population, the susceptibility within the between group of population, and the probability of transmission per contact. In order to implement the multi-group susceptible infected recovered model, I used three epidemiological cluster, which are susceptible, infected, and removed. And it was further grouped into workers, young, and senior citizen. The assumption of this model is that when the mobile workers get infected, it can transmit the disease through other mobile workers, to the senior citizen, and to the young. In this paper, we also assume that those who ages from below 21 and 60 years old and above are not entitled to go outside and prohibit to go outside the quarantine area. The schematic diagram of multi-group susceptible infected recovered model are as follows. The infected working who are first exempted in the ECQ could be possibly infect the susceptible senior, the susceptible under working condition, and those young. And those young could be recovered in a certain period, and also for those who are worker and senior citizen. The result of my study revealed that in the absence of the enhanced community quarantine, the probability of or the chances of transmitting COVID-19 disease in the national capital region across mobile workers is at 100%. From workers to senior citizen is 99%, and to the young group is 64.01%. By the end of July 2020, the COVID cases in the national capital region is forecasted to reach up to 29,000 amid the implementation of general community quarantine, which started last June 1, 2020. This is much lower compared to the predicted 900,000 cases if we do not implement ECQ or enhanced community quarantine last March 17, 2020. And if it was prematurely lifted on April 14, 2020. A possible explanation of this is, with more than 5 weeks of ECQ implementation, workers have somehow adapted to the new normal. That is, the habit of regular wearing of protective masks, ensuring physical or social distancing, and frequent hand washing or disinfecting of hands. Among local government units, Caloocan showed a sluggish movement of transmission rate were associated with continuous mobility of people under quarantine, which affect the movement of transmission to be more or less concentrated to zero. The curve for mobile workers are expected to flatten first, and then followed by the simultaneous flattening of the curve of the workers under ECQ, and then the senior citizen and the young age group. Interestingly, Quezon City will have different order of flattening of the curves. Those of the mobile workers first to reach flattening of the curve, followed by the young age group, the workers under ECQ, and then by senior citizen. In the city of Manila, the sequence of flattening of the curves of the four groups is as follows. First is the mobile workers, first to attain the flattening of curve, followed by senior citizens group, the young age group, and then the workers under ECQ. After the period of flattened curve, there is a recovery period which ranges from the shortest of 7 days for workers and the young age group to a maximum of 45 days for the senior citizen. Factoring this recovery period, LGUs that attain the flattening of the curve will reach a state of equilibrium where the fatality rate and the recovery rate is equal to the number of confirmed cases. An additional quarantine period of 14 days is usually required of a recovered patient in order to observe whether a relapse has occurred. Thus, factoring this into the scenario, all of the local government units in the National Capital Region shall be considered cleared of the disease of the community. Quarantine may be lifted by the third week of or fourth week of August and can be relaxed into the continuation of the general community quarantine. The transmission of the COVID-19 disease from workers, mobile workers to other mobile workers can be represented by this graph. Due to implementation of the ECQ from March 17 to May 15, as you can observe, the transmission of COVID-19 from workers to other workers declined significantly. During the implementation of the modified ECQ from May 16 to May 31, the transmission rate shows a slight increase. And during the implementation of the general community quarantine, which started last June 1, 2020, the transmission rate is increasing slowly. Meanwhile, in terms of the transmission rate from the mobile workers to the senior citizen, the implementation of ECQ from March 17 to May 15 significantly decreases the transmission of COVID-19 cases from the mobile workers to the senior citizen. During the implementation of the modified ECQ, the same with the transmission from mobile workers to other mobile workers, the transmission from mobile workers to senior citizens shows a slight increase. Meanwhile, during the implementation of the GCQ, the transmission rate is increasing in a slow rate. And for the transmission from mobile workers to the young age group, it resulted to a decline in the transmission of the COVID-19 disease. And during the implementation of modified ECQ, the same with the other group, the transmission rate shows a slight increase. And during the implementation of the general community quarantine, the transmission rate is increasing at a slow rate. Meanwhile, interestingly, if you observe the transmission rate due to the relax of the community quarantine from modified ECQ or from ECQ to modified ECQ to general community quarantine, it shows a slight increase. However, in terms of the recovery rate, those three groups of population, which are workers, senior citizens, and young, significantly shows an increase in the recovery rate. And as of June 17, 2020, the recovery rate of the workers and the senior citizen plunged up to 35 to 40%. Meanwhile, for the young, we have 15 to 20%. In terms of the fatality rate in the National Capital Region, if you can observe, from the March 8 to April, and in the midst of the implementation of the ECQ, it dropped down the fatality rate. However, during the relapse of, or during the lifting of the ECQ, it resulted to higher fatality rate ranging from during April 12 to May 27. And as you can observe, from June 1 to June 16, the fatality rate of the National Capital Region in the three groups shows a decreasing pattern. Meanwhile, the transmission rate in the mobile worker continues to increase due to shifting from the modified ECQ to the general community quarantine. The recovery rate of mobile workers group is expected to be 100% in the first week of the November. This is based on the actual data as of July 17, 2020, and based on the recovery rate of the National Capital Region. By the way, the recovery rate is being computed based on the number of recovered person divided by the number of the infected people. And the fatality rate of mobile worker expected to be 0% at the end of September 2020. The National Capital Region is expected to have an equilibrium in terms of the mobile workers in November 2000, in November 14, 2020. The transmission rate in senior citizens group continues to increase due to shifting from modified ECQ to general community quarantine. The recovery rate of citizens group is expected to be 100% in the third week of August. The computation of the forecasted recovery rate of the senior citizens group is based on the number of recovered in the senior citizens group and the number of infected person. The fatality rate of mobile worker expected to be 0% in the third week of August. Meanwhile, in terms of the young age group, the transmission rate in the young age group continues to increase due to shifting from modified ECQ to general community quarantine. The recovery rate of citizens group or the young citizens group is expected to be 100% in the second week of September. And the fatality rate of mobile workers, like in the mobile workers, the young citizen is expected to have 0% at the second week of August. After the period of flattened curve, there is a recovery period which ranges from the shortest of 7 days for workers and the young age group to a maximum of 45 for the senior citizens group. Factoring this out, the local government units should relax the community quarantine based on the equilibrium of the following. First, it must consider the transmission rate. The second one, it must consider the fatality rate, and the other one must consider also the recovery rate. This is based on the heterogeneous recovery rate, transmission rate, and also the fatality rate of different group of individuals such as young adult and young adults or the senior citizen and the mobile workers. Those reaching a flattening of the curve in the end of May are forecasted to attain equilibrium at the end of the July this year. However, because of very low recovery rate that is associated with long recovery period, the city of Pasig, based on the model, will realize an equilibrium state. In my first model, it will have an equilibrium based on the transmission of the disease, the recovery rate, and fatality rate in the first week of August, assuming that there is a continuous implementation of the enhanced community quarantine. But since we shifted from the enhanced community quarantine to general community quarantine, the whole NCR is expected to have an equilibrium at the end of November 2020. An additional quarantine period of 14 days is usually required of a recovered patient in order to observe whether a relapse has occurred. Thus, factoring this into the scenario, all the local government units in the National Capital Region shall be considered clear of the disease and the community quarantine and may be lifted third week or fourth week of August. That is, if the enhanced community quarantine were continuously implemented from May 15 to the current situation. But due to shifting from the enhanced community quarantine to general community quarantine, it resulted to slide down of the equilibrium into November 2020. And after reaching the equilibrium, you have to add additional 14 days in order to secure that there is no relapse of the COVID-19 transmission. Based on the result of this finding, the National Capital Region supposed to be needs to have more extension of the enhanced community quarantine. And for LGU cases of lifting thereafter, the second week of May 2020. But since we have shifted to the general community quarantine, it slide down the recovery rate and as well as the transmission rate of the National Capital Region into November 2020. The equilibrium between recovery rate, fatality rate, and heterogeneous mixing pattern of transmission rate in different age groups should take into account as the basis of lifting either the ECQ, the GCQ, or modified GCQ, or turning the GCQ into modified GCQ. The government should continue the work from home scheme at the end of the August 2020 and observe skeletal forces until November 2020 in the National Capital Region. And consider lifting the enhanced community in some areas outside the National Capital Region which have zero transmission rate for the past 15 days and the wide household distance and observance of the wide household distance. This would allow the economy to lessen the impact of the government intervention in curbing the spread of pandemic disease in the local and national economy. Because considering the implementation of the enhanced community quarantine and general community quarantine, it has a significant impact in the domestic and national economy. We have to balance the impact between the local and national economy and the spread of the COVID-19 disease. The government should provide ample temporary shelter for the health service workers, such as doctors, nurses, and other medical staff, and those who are working in the armed forces of the Philippines and Philippine National Police to limit their mobilizations, since they are more susceptible in the COVID-19 cases. Remember that the more the frontliners are increasing the mobilization, it will result to further increase in the transmission of the COVID-19 cases. Then continue prohibiting the conduct of face-to-face classes until the second week of November 2020. This is based on the implementation of the general community quarantine that resulted to a slide down of the equilibrium of the disease between the recovery period, the transmission rate, and as well as the fatality rate. But given that if the government continued to implement the enhanced community quarantine up to the end of the July 2020, it will result to an equilibrium in the transmission rate as well as the recovery rate and the fatality rate at the end of August 2020. Then limit the mobilization of household heads into every 3 days for a maximum of 3 hours and observing schedule per hour. This limiting the household mobilization is being observed in other countries where the household is only are allowed to go outside the home in every 3 days for a maximum of 3 hours. This to avoid too many household heads who will by necessity at one point in time and the same places. Senior citizens should not be allowed to be mobile during the ECQ and general community quarantine and be limited in terms of mobilization thereafter the third week of May 2020. However, they should be given separate financial and medical assistance such as immune system booster and other necessary medicinal aid so that they will not be completely helpless amidst the suggested containment. Continue prohibiting the conduct of face-to-face until the second week of November and continue flexible learning scheme. Sampling testing for COVID-19 per household and empower contact tracing. Then limit the mobilization of the household. And the government is recommended to create an ad hoc committee specifically dedicated to contact tracing, which may be composed of the Department of Information and Communication Technology, the Department of Health, and other pertinent agencies. That ends my presentation, and I will be accepting any questions.
Okay, thank you, Dr. Dizon. Just a reminder to our participants, should you have any questions, feel free to post them in the public chat space. But please introduce yourselves by telling us your full name, affiliation, and or your country. Okay. Now we will proceed to the reactors. The first reactor is a PhD candidate in public administration at the Shanghai Jiao Tong University, okay, School of International and Public Affairs. His research interests and publications are in political theory and philosophy, comparative politics, and public policy. So, ladies and gentlemen, Mr. Anthony Lawrence Borja.
Good afternoon, everyone. Again, first and foremost, thank you, Dr. Dizon, for that insightful presentation. Dr. Dizon's presentation has shown the challenges facing the Philippine economy in its gradual reactivation. And this applies especially to the labor market, which currently suffered an increase in unemployment rates. Now, the Philippine economy is bound to move towards a new normal. That's one thing that's for sure. We cannot keep everyone in their homes, even if Dr. Dizon advised for an extension of the quarantine period, which I think is reasonable. But the new normal within or after this pandemic places health conditions and vulnerabilities at the forefront, not only in policy making, but also in policy analysis, data gathering, and analysis. And I think my two comments will revolve around those two issues. First and foremost, I think Dr. Dizon used the individual as the basic unit of his model.
Yes.
Can we use the household instead in further developing this model? This is due to the fact that the household is the unit being used by local governments as of now in implementing specified quarantine. I live in Muntinlupa, and as far as I'm concerned, we have several villages here, compounds that underwent quarantine. So they're not only targeting individuals, but they're targeting not only households, but entire groups of households. So can households be used as a basis for further development in this further development of this model. Again, since this is current practice right now, especially for local government units. And of course, the focus of the model is transmission. So that's one thing. People go out of their homes, they come back. First and foremost, the primary targets, or at least the primary what you call vulnerable entities, would be the members of the household itself. My second comment would be, how can we integrate existing classifications of workers into this new model? You propose workers under ECQ and mobile and those in their own homes. So what about worker classifications based on employment sector? Those working in services, those working in construction, upon the reactivation of the economy, can the model absorb those existing classifications for workers? My focus here is on, again, we are preparing ourselves for the return of workers into their own workplaces. Yes, we have arranged for working from home schemas, but that's not applicable for many sectors of our economy. Again, going back to labor market issues, there's also the issue of friction. I mean, workers cannot move from one sector to another that easily. That's one thing that's for sure. So those in skilled and semi-skilled sectors cannot easily move to those providing work from home schemas. But again, overall, I think this presentation really puts weight on the challenges, the obstacles that the government is facing regarding the reactivation of the economy. Again, this should be looked at from the perspective of both the local and national governments. I think that is those are my two comments for now. Again, thank you, Dr. Dizon, for the presentation.
Okay, thank you, Mr. Borja. Dr. Dizon, you'll have a chance to respond after Dr. Joaquin shares his reaction. Okay, so our next reactor is an associate professor of philosophy at De La Salle University and a research fellow at De La Salle University Southeast Asian Research Center and Hub. He specializes in metaphysics, logic, and ethics. So, ladies and gentlemen, Dr. Jeremiah Hoven B. Joaquin.
Hello, good afternoon. Hello, Dr. Dizon. I really enjoyed your presentation. It's insightful. I hope that the government really listens to you, to us in this discussion. Well, I have one main point, and that's in the question that's posted there. Aren't mathematical models socially constructed anyway? Now, to develop this particular idea, I think here's the outline. I'll just talk about SRI models and the public health policies that you have discussed, just to review. Then I'll ask a question about the objectivity of those models, and I'll give you some philosophical ideas from realism and social constructivism, and let's see the upshots. So as you have discussed, the call to flatten the curve has been all around us. It's been a buzzword for the longest time. I think this call comes from the SIR model developed by the Imperial College in early March of this year. They use the SIR model, as you have discussed, the suspected, infected, removed, recovered model, and gauge the rate of infection in terms of that. So the rate of infection is the buzzword right now in DOH when they talk about the R naught rate of infection, with infected people in the population. Now, given the model, we have public health policies, which have varying levels of community quarantines, social physical distancing, and treaties that the government has issued: test, trace, and treat. However, these mathematical models. Well, here's a definition. A mathematical model is an abstract, simplified mathematical construct related to a part of reality and created for a particular purpose. Now, I'll give you a formula of how to think about models. So here's a subject, S. He uses the model, M, to represent part of reality, W, for a specific purpose. Now let's try to break that down. So the subject, the scientists, the politicians, the policymakers, use a certain model, M, to represent that bit of reality for the purpose of whatever. So let's focus on models and reality. So the models aim to represent bits of reality. So in the case of the pandemic models, it tries to represent the bits of reality concerned about infection, okay, the susceptible, the infected, and so on. Now, the key thing about models is that we have specific purposes for them. We use models for, well, practical purposes, perhaps. But what's our purpose? That's the main question that I'd like to ask. And a question about objectivity. If models are used for specific purposes, then how objective can they really be? Now, I'll give you two bits of philosophy here. So there's a realist school and there's a social constructivist school. So for the realists, they'll say models are used to describe bits of reality in order to predict possible outcomes and to recommend policies accordingly. On the other hand, if you think about realism and translate that into our SRI models, then given the SRI model, policies are drafted to ensure public safety. That's good. Now, there's the other extreme, the social constructivist extreme. So they say that models are our own made and are influenced by social factors. And they're used so long as they serve the purpose we like. Now, given this idea, we'll see that we can change the parameters of the SRI model, like what DOH is doing right now, have fresh and old cases, okay? Then fit our policies accordingly. Now, here are the upshots of those two philosophical schools of thought. Now, we want to be realists about models, right? So the model that you have given us, right, the recommendations that you have provided are good because we want to be realist about models. We want our models to depict the reality. And accordingly, our policy should be grounded on those sound scientific models. But is this what's going on in the Philippines, in our case? Here's something from Secretary Duque a while back when he's talking about the first wave, okay, that we are already in the second wave and so on and so forth. And here's something from Secretary Roque when he says that, no, we're still in the first wave. So what's going on there is that, oh, by the way, there's something from the president as well, that he still trusts our Secretary of Health. So what's the actual situation? What's with what all that's going on in how the Philippine government is handling the pandemic? It seems that social constructivism is the philosophical standpoint they're assuming. Now, there's nothing wrong with social constructivism per se, if it yields positive and socially beneficial results. But I'm not sure if that's the case in the Philippines. Thank you.
Okay.
Thank you, Dr. Joaquin. Okay, so Dr. Dizon, you may now respond to the reactions.
For Dr. Borja, first, due to unavailability of the data given by the Department of Health, I cannot collect it into household level. There is no tracing between individuals who are infected due to the limitations of the data. Then I try to incorporate the different sectors of workers, such as those who are working in the manufacturing sector, those who are working in the health workers and those who are in the national defense. Because I used this data in order to get the mobilization rate of the workers. So I decipher the mobilization rate based on the allowed workers to continue to operate during the enhanced community quarantine. But there is a sudden shift of the model since we diverted from the ECQ to to modified ECQ and to general community quarantine. And in my latest model, I assume all the sectors will be open during the general community quarantine, and certain percent, and I also incorporate a certain percent of mobilization based on the different sectors of the economy. For Dr. Joaquin, maybe we should coordinate. Maybe we should be dealing with the statistics before we actually generate some conclusions. I'm pretty sure that the government is also seeing the statistics of the Department of Health, but unfortunately, if I look at some of the data, there are still missing information, such as where is the particular local government unit where this patient belong. During my crafting of my model last April 2020, the specific local government units where the patients belong is completely indicated. But if you see the current data, there are some data that are still missing from April, at the end of the April to July 2020, June 2020. So there is a disruption in the model or disruption in the policy if we cannot completely fill in the information being needed for the forecasting, because the data is important in order to have a sound and sound judgment in terms of the policy making of the government. I think the government should provide a detailed information about the patients, so that more of the epidemiologists and statisticians and other those researchers who are on crafting a model of forecast to recommend a policy would be more accurate.
Okay. And your reactions from our reactors?
Again, from a public policy perspective, yes, I do understand that we are bogged down by a lack of detailed sets of data regarding policymaking, and that's also the reason why I asked if we can use the household, because I am aware that we don't have data on it. And that's the thing, if we are to prepare for the new normal, if we are to at least use this crisis as an opportunity, I think we need to strengthen our statistical arm in the government. That would require new mechanisms to gather data, new points of inquiry, as well as areas to focus on. So yes, and one point that I would like to emphasize would be the need to have household-based data. That's one thing. We move on from individuals, which is something utterly Western, into something more applicable to our current situation, which is household-based transmissions.
And Dr. Joaquin, and your reactions?
Yeah, I have to agree that we have minimal data. But the main point is, despite having data, or in spite not having data, right? So there's still that philosophical question: what are models for actually? How do we use them? Are they just for political gain, or are we picturing reality as it is? I think that's the gist of my reaction to all possible models, or even models. I think we have questions in the Q&A part.
Yes. So we have a question from an anonymous attendee. And it states that while the DepEd states that it will follow the president's mandate of not holding face-to-face sessions, teachers are prompted to arrange classrooms for face-to-face. And this is very confusing because DepEd is saying, because what DepEd is saying and what they are really doing is in conflict with each other. So what are your thoughts about this?
Um, the implementation of the flexible learning should be depend on the number of cases and as well as the recovery rate and the fatality rate of each local government unit. If you see my model, uh, the implementation of the enhanced community quarantine, it is supposed to be if you continue the enhanced community quarantine up to August 2020, the face-to-face is based on the recovery rate and as well as the fatality rate and transmission rate should be settled at the third week of September. So this is based on the number of persons who are recovered from the disease and those who are fatal and the transmission rate. If the transmission rate is equal to the number of those who recovered and those who fatal, that is the term of the equilibrium. And that is the time where we can conduct a safe to conduct face-to-face mode of instruction. Meanwhile, due to shifting from ECQ to modified ECQ and to the general community quarantine, it resulted in a slide down of the equilibrium. Instead of September, it slide down until November. This is due to the main factor of this is the mobilization of the workers who can transmit the disease to those who are in the quarantine, such as those who are young and those who are senior citizen. So those mobile workers can transmit the disease to other mobile workers and also to those who are in quarantine, such as senior citizen and the young citizen.
Well, we have a related question from Jasper King Casimiro of Quezon City, a PUP MPA student. And basically, he's asking if you can predict the increase, considering how there's a probability that we will proceed to MGCQ by the end of the month. And in his question, he predicts that it is likely that the cases are likely to spike again. So can you predict?
Yes. Actually, if in the current situation, due to the implementation of general community quarantine, it resulted to a slight increase in the transmission rate. And if we transfer from the general community quarantine to modified general quarantine, it is predicted to increase the transmission rate. But more so, if the general community quarantine will be shifted to modified general quarantine due to what we call the employment purposes and the economy, to relax the economy in our domestic and national economy in order to recover, what the government may do should increase the capability to recover and also reduce the fatality rate. If we have an increase in the recovery rate faster than what is in the current situation and slow down the fatality rate, I think if we can go to modified general quarantine, it's safe to go to modified general quarantine in spite that the transmission disease is increasing. Though the increase in the transmission rate is somehow due to the previous effort of the government, somehow controlled in these days, but there is still chances to increase the transmission rate. But somehow is being controlled. Unlike in the first implementation of the enhanced community quarantine, where we have exponential increase in the transmission rate during March 1 to the March 30.
Okay. Now we have one last question, and this question was sent through Facebook. This comes from Neri Laurio Dizon of DepEd Bulacan. The question is, what is the significant effect of the Balik Probinsya program in the overall situation of COVID-19 in the Philippines?
Okay. The Balik Probinsya program, the government will result to what we call disperse of the COVID-19 cases in the Philippines. When the objective of enhanced community quarantine is to contain those who are susceptible and those who are infected. If the susceptible area and the infected area would increase its capacity by the so-called Balik Probinsya program, it would disperse the cases of the COVID-19. While if we look at the case during last May 2020, there is a decrease in the transmission rate in the Philippines as a whole. But if you look at some cases due to the implementation of the Balik Probinsya, the COVID-19 cases dispersed widely in the entire region of the Philippines.
All right. So those are all the questions that we received. Do our reactors have any parting words? Are there any questions you'd like to add?
Just thank you, Dr. Dizon, for a wonderful talk. I hope that the participants here learned a lot. I learned a lot from your paper, and I'm looking forward to hearing more predictions from you in the future. Stay safe.
And again, thank you, Dr. Dizon, for the paper. I hope that you can further develop the model in line with the current realities that we have here.
Okay, Dr. Dizon, any parting words?
We may appeal to the government that we should widen the information that being collected by the Department of Health in order to have the more accurate forecast, and as well as to suggest more or give some recommendation in terms of the transmission of the COVID-19.
Okay, thank you very much. Now, on behalf of the Southeast Asia Research Center and Hub, I'd like to thank our participants, our reactors, and our speaker, okay, Dr. Dizon, for this very interesting webinar. I've learned a lot, and like I said earlier, I hope that your findings will somehow reach people who have the means, to take control of the current crisis, and hopefully our research will be able to contribute to solving the problem we have with COVID-19. So thank you very much for joining us this afternoon in this webinar. Again, magandang hapon sa inyong lahat and have a nice day. Okay, so maraming salamat ulit sa inyo. Bye.